Good morning, everyone. My name is Sophia, and today I'll be talking about upper cross syndrome. So, what is upper cross syndrome? It's a altered muscle activation and inhibition causes a movement pattern dysfunction of the head, neck, shoulder, chest, and also back. So, to put it simply, it's a muscular imbalance condition caused by poor posture over some extended period of time. And then there is no standardized classification for upper cross syndrome, but we can categorize it according to the severity and presentation. So first, there's a mild upper cross syndrome. The posture will be slight forward head posture with rounded shoulder. The symptom will be occasional pain of the neck and shoulder. Then there's a moderate upper cross syndrome where there will be pronounced hunchback and forward head posture, frequent neck pain and shoulder and upper back pain, and also there will be mild headache. And we have a severe upper cross syndrome. There's a extreme forward head posture with severe thoracic kyphosis and also scapular winging. The symptom will be chronic pain, nerve may or may not have nerve compression with numbness and tingling in the arms, headache, and also restrictive movement of the neck and also shoulder. So how does upper cross syndrome happen? Primary pathophysiology of upper cross syndrome is a reciprocal inhibition in which there is an overactive muscle inhibit their antagonist muscle, leading to dysfunctional movement pattern. So for example, the tight or overactive muscle will be our pectoralis major and minor, our upper trapezius, levator scapula, sternocleidomastoideo muscle, and also suboccipital muscle. And also the weak muscle or inhibited muscle will be deep neck flexion muscle, lower trapezius or serratus anterior, rhomboid, and also mid trapezius. So what will happen is there will be a forward rounding of the shoulder from the tight pectoralis major and minor, the shoulder elevation and neck tightness because of tight upper trapezius, and also forward head posture because of the tight sternocleido and also suboccipital muscle. So from the weak or inhibited muscle, from the deep neck flexion, we are unable to maintain the head position. There will be scapular instability and also unable to retract and stabilize the scapula. So the result combination of this tight anterior muscle and weak posterior muscle creates a cross pattern when viewed from the side of the patient. Other than that, we can see from this muscular imbalance, there will be neuromuscular dysfunction as well. So when the pec and upper trapezius become overactive, they will inhibit the deep neck flexion and also lower trapezius. So it creates a cycle where weak muscle fail to activate, and then there's a worsening of the postural imbalance. So the body will compensate by using a secondary muscle. So there will be more straining on the neck and also shoulder and also upper trapezius. And also poor posture also will alter the sensory feedback from muscle and also the joint. They will be disrupting the coordination and movement control. So the brain will adapt to this poor posture, making it like a new normal, so which reinforce the faulty movement of the pattern. So what are the risk factors for upper cross syndrome? One is the poor posture. So when you're looking down on your phone too long or sitting at the desk with using computer for extended period of time. Sedentary lifestyle, the ergonomic of the workplace, meaning the workstation is not proper, stress and tension, repetitive movement, for example, from job or athlete like swimmer, which they strain their neck and shoulder, poor sleeping posture or carrying a heavy backpack. And then the manifestation first will be postural and abnormalities. So like I said earlier on, there will be a forward head posture, elevated shoulder. There's a hunchback or thoracic kyphosis of the upper back. And then there will be muscle tightness, usually on the upper trapezius, our pectoralis major, our levator scapula, and also our scalene muscle. And also muscle weakness, usually in middle and lower trapezius, rhomboid, serratus anterior. The patient will always complain of neck, shoulder discomfort, and headache, and there will be limitation in the functional activity. For example, difficult in overhead reaching and also reduced range of motion in neck and also shoulder. Okay, so how do we assess and diagnose upper cross syndrome? So firstly, in patient history, we ask history, how is their physical activities like, their lifestyle, their habit, their posture. And then second, we do inspection from the side of the patient. We do postural assessment. We look for the forward head posture, there's any rounded shoulder or hunchback, and the thoracic kyphosis. And then we assess range of motion of patient, the cervical flexion, extension, and rotation, the thoracic spine mobility, and also the shoulder range of motion. And we can assess the functional assessment. We ask patient to try overhead reach or lift, and we observe if there is any muscle limitation or imbalance. And then we palpate their upper trapezius, their anterior scalene, the pectoralis major, and we assess the muscle strength. Imaging is not necessary, but we can do X-ray to assess the severity of the kyphosis. Okay, and then treatment. First, for treatment, we do stretching of the tight muscle. So we can do chest stretch or doorway stretch for the pectoral, and then we can do upper trapezius or levator scapula stretch, and then a latissimus dorsi stretch. And then we can do strengthening of the weak muscle. First, we can do chin tuck exercise for the deep neck flexion, the scapular retraction for the trapezius and rhomboid. And then we can advise patient for postural awareness and also ergonomic. So first is to keep the head in neutral position, and then for ergonomic, for workstation, we can advise eye level, same place as the monitor, and for a support for the lower back. And then lastly, manual therapy, we can do foam rolling, massage, or dry needling. Okay, so the key takeaway from upper cross syndrome is, first, upper cross syndrome caused by muscle imbalance, neuromuscular dysfunction, and poor posture. It may lead to chronic pain, joint dysfunction, and movement restriction. Hence, early intervention and stretching, strengthening, and postural correction can prevent complication for upper cross syndrome. Thank you.